Welcome to this explainer. Look, today we're exploring a topic that is deeply personal, super fascinating, and honestly, profoundly empowering. We're talking about fertility preservation, and specifically the science and the heart behind egg freezing. If you've ever felt completely overwhelmed by all the clinical jargon or, that ticking biological clock, just take a deep breath. Consider this your warm, supportive guide. We're going to unpack these options together and clearly illuminate the steps you can take to protect your future family. So, what if you could just pause time? It's a pretty powerful thought, right? Because we all know everyone's life path is completely unique. And sometimes our personal goals, our career aspirations, or even sudden medical realities just do not neatly align with our biology. Deciding to start a family is a massive milestone. But what if you just aren't ready right now? Or what if physically you can't be ready right now? Well, the good news here is that modern medicine has actually created a way to hit that pause button.
Section 1. Understanding fertility preservation.
Okay, let's transition into the science a bit. And hey, I want to reassure you right out of the gate, if medical terminology usually makes your eyes glaze over, do not worry. We are going to break down every intimidating term together. Let's start with the foundation. Oocyte cryopreservation. I know, that is a very big, very medical way of saying egg freezing. In plain English, it's just the process of safely extracting a woman's unfertilized eggs, freezing them, and storing them securely. Doing this at a younger age is just a wonderfully proactive way to protect your future reproductive potential. You're essentially taking the high-quality eggs you have today and saving them for the future version of yourself.
Now, a really common point of confusion is the difference between freezing eggs and freezing embryos. Basically, egg freezing involves unfertilized oocytes. That's just the egg all on its own. Embryo freezing, on the flip side, means the extracted egg is fertilized with sperm from a partner or husband first, creating an embryo, and that is what gets frozen. This is an option very often chosen by married couples who might be going through IVF or who just want to prep for their joint future. Both are absolutely incredible options, and it entirely depends on your current life circumstances.
Section 2. Who chooses egg freezing?
It's so important to validate your why. People explore this type of care for incredibly diverse reasons, and every single one of them is completely valid. The realities that actually lead people to fertility clinics usually fall into a few main buckets. First up, medical treatments. Women diagnosed with cancer might need chemo or radiotherapy, which can unfortunately be toxic to the ovaries and cause premature egg loss. Second, surgical interventions. Things like surgeries for severe endometriosis that might damage ovarian reserves. Third, genetic conditions, like Turner syndrome, which puts some women at a higher risk of premature ovarian failure. And finally, social or personal reasons. I really want to emphasize this right here. Whether you are facing a scary medical diagnosis or you just want to wait, there's absolutely no wrong reason to take control of your timeline.
And touching on that last point, a really interesting option to highlight is social freezing. This is just the term used when someone chooses to postpone building a family simply because life isn't ready for a baby yet. Maybe you want to focus on your education, or perhaps you're building a killer career, or hey, maybe you just haven't met the right partner to build a family with yet. Let's normalize this. Securing your future simply because you aren't ready right now is a perfectly valid, smart, and truly empowering choice.
Section 3. The step-by-step process.
A lot of times, the anxiety around all this comes from simply not knowing what actually happens. The great news is it's a super manageable journey. It typically requires just 10 to 14 days of specialized care. Here are the 3 main phases. Step 1 is ovarian stimulation. In a natural monthly cycle, your body usually produces just 1 egg. But here, doctors want to retrieve multiple eggs to give you the best future chances. So you'll take hormone injections to help several follicles grow at once. Step 2 is the egg retrieval. Once they're mature, they are collected. I know, it sounds a bit scary, but it's a day-case procedure performed under sedation, meaning you are completely comfortable and pain-free. And step 3 is vitrification, which is where the magic of modern science really steps in. See? A totally manageable, step-by-step path, no scary unknowns.
Let's look a little closer at that last step, because the crucial point is how the eggs are actually frozen. Older freezing methods sometimes allowed ice crystals to form inside the cell, which could really damage the delicate egg. Vitrification, though, is a revolutionary flash freezing technique. Because it freezes the egg so incredibly fast, ice crystals literally don't have time to form. This breakthrough technology keeps those delicate eggs perfectly safe and has significantly increased their survival rate for when it's time to thaw them in the future.
Section 4. Other preservation options.
So we've talked a lot about egg and embryo freezing, but it's really important you know all the possibilities out there, especially for highly specific or urgent medical cases. For some patients, traditional egg freezing just isn't feasible. A profoundly hopeful alternative here is ovarian tissue cryopreservation. This is designed particularly for young girls who haven't even reached puberty yet, or for women who receive a diagnosis and have to start aggressive medical treatments immediately, meaning they don't have that 10 to 14-day window needed for regular egg freezing. In this procedure, a small portion of ovarian tissue containing immature eggs is removed and frozen. Later on, that tissue can actually be transplanted back to restore hormonal function and fertility. It's a true beacon of medical hope.
Section 5. Taking control of your future, logistics and costs.
All right, now that we understand the science and the steps, let's talk logistics. The UAE has truly emerged as a global hub for reproductive excellence. Facilities over there, like ART Fertility Clinics, offer expert, highly personalized care. And because they use the absolute latest, state-of-the-art cryopreservation protocols, patients have access to super comprehensive options. Whether it's egg, sperm, or embryo storage, these clinics are fully equipped to handle even the most complex cases with incredibly high success rates, all while keeping patient safety as the absolute top priority.
Of course, navigating the financial side is a very real part of this journey. The total investment usually includes a few specific things: your initial medical consultations, the cost of the ovarian stimulation medications, the surgical retrieval procedure itself, the specialized laboratory fees for that flash freezing vitrification process we talked about, and finally, an ongoing annual storage fee to keep those cells safe in a cryobank. Now, while the costs do vary based on individual medication needs, it really helps to frame this not just as a medical expense, but as a profound investment in your future peace of mind.
And why is this investment so timely? Well, age 35. The biological reality we all kind of have to face is that the quality of a woman's eggs is the single most critical factor in achieving a healthy pregnancy later on. Unfortunately, egg quantity and quality do naturally begin a more rapid decline after age 35. Older eggs are just more prone to genetic abnormalities. So, by acting early, ideally in your 20s or early 30s, you're effectively locking in your current egg quality. You are giving your future self the absolute best possible chance at success.
Let's wrap things up with this beautiful, uplifting thought straight from the clinical experts. Fertility preservation is an empowering choice that provides flexibility and hope. Whatever your reason for exploring this, a medical diagnosis, focusing on that big career, or simply wanting to wait for the exact right time, this technology removes the heavy pressure of a ticking clock. It leaves you firmly in the driver's seat of your own life. So, I'll leave you with this to ponder. If we no longer have to let biology dictate the timeline of our lives, how much more freely and fully can we live today? Thanks so much for exploring this guide with me. I really hope you leave feeling informed, reassured, and most importantly, empowered.